Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And I talk about collaborative healthcare, communications between physicians, et cetera, et cetera. And I've been looking around for a guest group that would talk about building teams with innovative minds to deliver quality healthcare. Now that's a long sentence, but that's why you're here. So let me introduce to you two people. Dr. Gilbert Beauperthuy-Rojas, I'd say lovely mom. He's a DO and a graduate of Nova Southeastern University, originally Southeastern University of Health Sciences, Southeastern College of Orthopedic Medicine. Welcome.
Thank you. Good to be here.
And I don't say old, a longtime friend, Jeff Welch, who is the CEO of Florida Medical Center, but even more significant, he's the Miami-Dade CEO Lead for the Tenet Health System. Welcome, Jeff.
Thank you.
Good to have you.
Pleasure to be here.
Good to have you. So, if I may call you Dr. B, tell me about your Orthopedic Center of Excellence in Coral Gables and how you deliver quality health care by doing team approach.
Sure. We are an Orthopedic Center of Excellence as granted by the Joint Commission. We got that accreditation a couple of years ago. It is essentially an accreditation that we got that delivers excellent orthopedic care in total knees and total hip replacements. We were doing good things at the hospital prior to this, and I approached the CEO at the time and I said, listen, we can improve on this and let's get some credit for it. Let's look at what we're doing. Let's see what needs to be done to get noticed. And certainly we were doing that stuff, and we put it all on paper and presented it to Joint Commission, and they gave us this accreditation. Essentially, it's a team approach on taking care of the patient, making sure they get quality health care, efficient quality health care with excellent results.
Well, you know, we've been talking quite often through this show about how healthcare has changed. I give a lot of credit to the pioneer physicians and hospital coordinated groups that created hospitals, and then we have the big corporations that have come in and added another dimension of quality to our systems. And it's always good to know the past before you really enter into the future. And because in order to make things better, you have to know when things weren't better. And that's why I now turn to Jeff Welch, who's been with the Tenet system for quite a number of years. That's all I'm going to say, Jeff. And I've known him, and he's a fantastic operating officer. It's not easy to run hospitals because you have to deal with the multiplicity of everything from good quality care to cleanliness to security to supplies and taking care of your board of directors and et cetera, et cetera. It's not an easy job, and I know that you have this multiplicity of responsibilities throughout Dade and Broward counties. So tell me, Jeff, how do you do it?
Well, it's very easy when you have great physicians to work with and great administrators. I always feel that it's important to surround yourself with great people, and because you're only as good as the people that work for you. But with our orthopedic program, the Center of Excellence at Coral Gables Hospital, there's a Center of Excellence at Florida Medical Center. Coral Gables is going for the advanced certification, which is awesome. And with physicians like Dr. Beauperthuy, you can get there easily. One of the things that's very impressive is the whole program. It's just not about a patient coming in and have surgery. By the first time that a patient sees Dr. Beauperthuy in his office, he gives them an education file, and the patient comes in before the surgery, gets to meet the nurses, gets to meet the orthopedic navigator, gets to walk into the OR and see the anesthesiologist. Then they go up to the unit that they'll be staying in. So it gets them prepared for the events to take place, and it gets them more comfortable. And we feel, and we've proven, that provides better health care, because when you have that continuity of care, they know the expectations, and they feel comfortable with it, and it's not as scary in a sense. And actually, as a result, I think Dr. Beauperthuy would agree that your actual length of stay is less, because they know what's going to happen, and we prepared their medical equipment for when they go home. So to your question, it makes it very easy working with great surgeons and great employees.
Well, Dr. Beauperthuy, otherwise known as Dr. B, you know, we often get questions from the viewers relative to surgical techniques, and the most common issue which people want to hear about are the minimally invasive techniques, the new techniques. They are interested in, because, you know, when the viewers talk about surgery or think about surgery, they talk about cutting, blood, pain.
To Jeff's point there, education on this is so important, not only from what we teach the patients, but the physician has to realize also that you can't be static. You need to be dynamic and be willing to develop your skills and continue to progress with the new technology that has come aboard. And I think all the physicians at Coral Gables Hospital are on board with that. In addition to what you also said about pain control and expectations, that's where the education for the patient is so important, the patient and their family. So they have an idea as to what to expect. And when you have an idea of what to expect, I think that lowers your anxiety level. And lowering your anxiety level also allows you to rehabilitate postoperatively a lot easier and a lot better. We incorporate a lot of pain management techniques that are narcotic-free, a lot of blocks, so on and so forth. The narcotic epidemic that we have in the U.S. right now, we're trying to, mitigate that from getting worse, and by implying or putting in some of these blocks, anesthetic blocks in the patients, we've diminished their pain tremendously, where a lot of them go in their postoperative phase without having to take narcotics, which is a great benefit, obviously, for the patient.
Well, you know, South Florida being a venue, and actually Florida, but mostly South Florida being a venue where we have so many people that want to be active. You know, people who retire, in quotes, to our area, they want to have an expectancy of good years to follow, many years to follow. And the greatest fear that the viewers have, to tell you the truth, it's always cancer, cardiac disease, and surgical interventions. Because in surgery, like I said, I started out by saying they think of pain, blood, and a lot of cutting. But in your area of excellence, at the Orthopedic Center of Excellence at Coral Gables Hospital, I know in reading some of the texts that are up discussing your Center of Excellence, there are a lot of new techniques that you're using that are far less invasive and far less, shall we say, destructive to certain elements of the body. So the reconstructive or the therapy elements have changed, correct?
Yes, absolutely. And our surgical technique has become more refined, where there's a lot less soft tissue damage at the time of surgery, which again allows for less pain, quicker rehab, and get the patient going. The day of the surgery, all patients get up and we start walking them on the first postoperative day, on that day of surgery, which is a great benefit to the patient, gives them great confidence in their ability, and gets them going a lot quicker. back into their active lifestyle if that's what they want to do.
I would also suggest
Yes,
that
Jeff.
robotic surgery. Coral Gables Hospital has 2 robots. We have 2 at Florida Medical Center. We're a center of excellence for robotic surgery, and that's a technology that is very costly to the hospitals. Yet what it serves a purpose of obviously being less invasive and allows the patient to get out of the hospital faster. So these technologies are better for the patients, and that's what we look for. When you make that decision to buy a robot, you make, I try to make every decision on what's best for our patients, and that's a patient decision to get that patient out sooner. The reimbursement doesn't change on a lap chole for a robot or an open procedure, but it is better for the patient.
Well, you know, talking about the robots, because we've had some very interesting comments from viewers over the years when people talk about robotic surgery. They think that, you know, it's something that they see on television or you know, old cartoons. You know, there's a metal thing walking up and starts to do whatever it is. No, people don't realize that. You see those hands? Dr. B, look, those hands. That's right there. The knowledge that is performed by those hands comes from up here and in here. Because I don't believe quality health care can be at all presented. This is my feeling. I don't like to do editorial comments, but without compassion, this knowledge doesn't allow the heart to do what these hands have to do. Am I on target, Dr. B?
You're absolutely correct. As a physician, and I think even as an administrator, you have to be compassionate, and you have to be willing to listen to people, not only patients, but those people that you're working with, and be willing to adapt some of their ideas into your program.
So, Jeff Welch, since you are a big boss of a lot of hospitals here, how do you inculcate within the physician groups who are working there these new innovative, I guess you could say, features that come up here in the mind to bring quality to their healthcare delivery?
A robot is an instrument just like any other instrument in the OR. And you're right, Dr. Lippman, you have to have great hands behind those instruments. And hiring quality top physicians in our organization, which is what Tenet is known for, and our hospitals have quality, very high quality physicians. Dr. Beauperthuy is a clear example of one of those. But I find that building those relationships, working together with the physicians, the administration, our community, our board members, that relationship is so important. I go by the 5 T's. Time is very important to the physician. You have to be transparent. You have to make sure that they know that they're part of the team. They have to trust you. But we can't work together if there's not that level of trust. And finally, to thank the physicians for being there and entrusting their patients to us.
Yeah. You know, it's interesting because, you know, a lot of our hospital units that are in the state of Florida, and particularly South Florida, which is very rich with hospital venues, you know, and I give great credit to a lot of our sister units that are here, whether they be public or be private or whatever. I mean, people are trying, but I think there's and maybe you can talk to this, the whole element of collaborative healthcare has now found its way into our systems with the creation of new multi-purpose, professional involved ORs, for example.
We have teams that will do the orthopedic stuff, but they'll also do other areas. But we try to have teams that are specialized in a particular area to stay with that particular area to be more efficient and provide better care.
And even the specialized care that then extends into what I call the gold of a hospital, and that's the nursing staff. I mean, to me, it's more than that. It's a platinum of the hospital. Without getting to your 5 T's, if you don't have the elements of those 5 T's in that nursing staff, it makes it very difficult, no matter how qualified you are, technologically or technique-wise, the patient really doesn't receive the quality care that you intend that patient to have, right?
Yeah, I would totally agree. Healthcare is a team sport. From the very bottom of making sure the hospital is clean, secure, that radiology is excellent, that community members are involved. It's a team sport, and I would challenge everybody that if you go into a hospital and you ask anybody, whether they're wearing a stethoscope or carrying a broom, that what they do here, they help save lives, because it takes a total team, and that total team has to be total quality.
Dr. B, knowing that you met all the standards of our founder, Dr. Morton Terry, in believing that the patient really is the one that makes you a good physician, that no matter what you know, if you don't listen to them, he always used to say, and I had a very close relationship with him, he always used to say to me, you know, 80% of what you really know in taking care of a patient comes from the patient. The other, you can see that maybe 10% comes from some diagnostic procedure, and the other 10% comes from here and the stethoscope. That's what he used to say to me all the time. And I know how well you were trained, but we've had the privilege of having graduates like you throughout the United States, but you're not here because you're a graduate of ours. You're here because you run the orthopedics, or you're the director, therefore you're running, the Orthopedic Center of Excellence at Coral Gables Hospital. And I got to believe that all those elements that were drawn to your knowledge when you received your initial education has to permeate your entire life. I got to believe that.
Absolutely. It's look, listen, and feel.
That's it.
Okay.
And the patient wants to tell you things often. I always sort of remand at the end of the show, I always say to folks, please talk to your doctors. They're not just people that walk into a room or do their thing and disappear. If you don't let them know, for example, oversimplistically, I mean, I'm sure before they get to you, Dr. B, they see their primary care physician, or there's some kind of a traumatic event that causes them to have orthopedic repair and things of that nature. But if they don't give you information, if they don't tell you what over-the-counter preparations they're taking, whether they're taking nutraceuticals, or they're doing this, and I've had this problem for 10 years, and yet I have done nothing about it. I just, I live with it. I would say, you're at risk of not being able to provide the knowledge-based quality of care that you want to drive through your Orthopedic Center of Excellence. Is that true?
That is true. You have to listen to the patient. You have to listen to the patient, and you also have to listen to your nursing staff. Like you said, I feel like the nurses are the sergeants, if you will. They're the ones that drive this and keep things in order and stable. So you have to be able to listen to those people.
That's good. Well, Jeff, it makes it easier for you as the CEO to know that you have partners in your job who are physicians like Dr. B.
Oh, absolutely. It's very comforting because when it comes down to it, it's about the physicians, their skill sets, their ability to, their bedside manners, and their ability. I see physicians all the time, and guys like Dr. Beauperthuy, he's a guy that can, which I say is a sign of true intelligence, that can talk to any person at any level. and he sees all different levels of patients and all different levels of people that he works with. But when you can communicate and relate to any level of person on that continuum, whether it's someone who's uninsured and low income versus a board member who's predominant in the community, and you can have that communication, it serves the purposes, and Dr. Beauperthuy is one of those guys.
Well, see that?
Thank you.
He just said something nice. You have a recording of that now, so next time you have a little conversation, you know, you got it.
I have to see him about my knee later.
Oh, okay.
No.
Where is Coral Gables Hospital located?
It's in Coral Gables, Florida.
Right.
It's on 37th Avenue and 31st Street, Southwest.
31st. So it's right smack in the
Middle of things.
Coral Gables,
Yep.
right. It's been around for a long time.
I believe about 90 years.
Yeah.
Yeah.
But I mean, I know they've gone through significant, I would say, not only construction, but internal value-added repairs and things of that nature. It's really a very significant venue in the eyes of the public.
Yeah,
I mean,
absolutely. And the administration wants us to label it as the new Coral Gables Hospital.
well, whatever they want to call it, I mean, that's all that counts with the people out there who you take care of.
Correct.
We're down to the last 5 minutes of this show, so I'm going to open it up to you, say whatever you want. So, Dr. Beauperthuy, it's all yours.
Well, you know, in delivery of healthcare, I think it's important to be a team player. All right, like we've discussed, you have to listen to the patient. You have to get the patient involved. You've got to get the patient's family involved. They've got to be involved in the patient's health care. And from the hospital point of view, you've got to get everyone involved in that. From administration, they've got to know that they've got to be part of this team, and they've got to give you the necessary needs to develop a good program, which the administration at Coral Gables has done that. When you have collaborated those, then you can get the insurance companies involved also, and you say, listen, we've created this, we're doing this educational process, we're going to deliver better health care for your patients, for the patients that are under your umbrella, and they become involved and engaged, and from there it goes on to the home health care agencies, and it becomes a big team, and communication is so important when you're doing this, willing to listen to what people are telling you. And if you do that, I think, and you get everybody in the room together, everybody's trying to deliver the same thing: good health care, efficient health care, and that is done with communication.
Mr. Jeff Welch.
Well, I would segue off of Dr. Beauperthuy's comment that we're living in an age of consumerism where the patients are looking and do a little bit more research on their own to find the best quality places. And places like Coral Gables Hospital, that's a center of excellence for orthopedics, and Florida Medical Center, which is a center of excellence for orthopedics and bariatrics and robotics. You really need to look for those services, because those certifications are not easy to get, and they're blessed by a very important regulatory agency, the Joint Commission, and all the tenant hospitals go for these certifications that are so critical. So when someone is looking for a hospital, whether it's orthopedics, heart, just general surgery, look for those places that have those qualifications and those designations, because that will help your decision.
Well, I want to thank both of you. I mean, my intent in bringing you here was to really talk about building teams, and I think you both explained that that's what it is. In other words, you know, being anything, being a doctor, being a star baseball player, or being a recording star, it isn't a medal on your chest. You're really there because of the composite nature of all the people that are around you. And if you don't reach out to your fellow colleagues, you're missing a big, big part of your opportunity to make the patient happy.
Yep.
Mm-hmm.
So thank you both for being here.
Thank you for having us.
Thank you.
Dr. Gilbert Beauperthuy, otherwise known as Dr. B, the director of the Orthopedic Center of Excellence at Coral Gables Hospital. And Jeff Welch, I don't know, you keep getting younger, I don't know why, but I keep getting older. And you're the CEO of Florida Medical Center and the Miami-Dade CEO Lead, which means that you're responsible for a lot more things than people want to even know about. But I thank you both for your service. Jeff, like I said, I've known you for a while, and Dr. Beauperthuy, we're very proud of the fact that you're an early graduate of Dr. Morton Terry's institution called Southeastern College of Osteopathic Medicine.
That's correct.
You're a very special person to us. So thank you both very, very much.
Thank you.
Folks, I hope that we gave you some insight into, again, all we're talking about now is the new healthcare. It's collaborative. It's not just show up and get something done and goodbye. It's communications between doctors, hospital employees, the opportunity to have better equipment, better care. So afford yourself that opportunity, but remember, I always tell you to take good care of yourself. And the only way you're going to do that is by telling your doctors things such as what over-the-counter preparations you take, nutraceuticals, whatever. You got to let them know, because your health care has a lot to do with what knowledge you give the physicians so they can help you be a better and healthier person. Thank you once again for showing up. We appreciate this opportunity. This program is called Dateline Health. We come to you from Nova Southeastern University. If you have any comments or questions, there's an email address and a phone number here. And remember, my name is Fred Lippman. Until next time, see ya.